An easier way to treat COVID-19 could be coming soon. Drug maker Merck says it will soon seek FDA approval for its new COVID pill. The company claims the pill cuts hospitalizations and deaths by half in people that recently came down with the virus. If cleared, the drug would be the first pill known to treat COVID-19. All other therapies authorized in the U.S. right now require an IV or injection. Our Liz Crawford digs deeper into how the pill works and how it could help you.
Patricia Diaz had COVID in April of 2020. There were no vaccines and hardly any treatment.
It's a scary feeling still to this day.
She spent days in the hospital and ended up on oxygen for weeks. She still has brain fog and fatigue.
I am grateful that I'm still here because I've seen so many people around me pass away from COVID.
The idea of a pill?
It would be such a blessing for all of us and anyone that had COVID.
A little pill, that kind of looks like this, could be key to ending this pandemic. Drug maker Merck says their COVID-19 pill is working.
It's going to be pretty much a game changer, I think.
Early results showed patients who received the medication within 5 days of having COVID symptoms had about half the rate of hospitalization and death as patients who received the placebo pill. The study tracked 775 adult COVID patients who were considered higher risk for severe disease due to underlying conditions.
This thing is going to be going to your pharmacy, getting a prescription filled and taking 4 pills. And you'll be able to go home. You won't show up in the hospital. And if you don't show up in the hospital, there's no strain in the emergency room in the hospital system.
Dr. Unnasch says this pill stops the virus from replicating. That will crush the virus, making people less likely to transmit and keeping them out of the hospital.
The hospitals are designed to really function under normal conditions. And a lot of people go to hospitals for a lot of other reasons other than COVID-19.
That pill could truly be a game changer for us. Merck executives plan to submit the data for review by the FDA in the coming days. Now, taking a deeper dive, besides helping those who are just starting to show symptoms, monoclonal antibody treatments are really the only way to treat people who were potentially exposed before they show symptoms. That's either given through an IV or through an injection. There are 3 manufacturers that have emergency use authorization. Monoclonal antibodies have been helping to keep people out of the hospital, cutting down the need for care about 70%, according to a Regeneron study. Now, if you do end up in the hospital with COVID, you could be given potent anti-inflammatories. Dexamethasone is given to those who are critically ill or on a ventilator. There are also steroids that can be given instead. One you've likely heard of is prednisone. Doctors are also giving out remdesivir. That's for patients who need minimal supplemental oxygen. It's an antiviral that's given through an IV injection.